In Harsh Vardhan's exit, a COVID admission and course correction, his departure is one of the strongest signals on the handling of the ferocious second COVID-19 wave. To the government's detractors, it is an admission of its failure, and to its supporter, a much-needed course correction to reassure the country. Of the 12 ministers who resigned ahead of the reshuffle, the one that caught the eye was the exit of Union Health Minister Dr. Harsh Vardhan. On March 7th, Harsh Vardhan announced that it was the end game of the pandemic in India. But cases started to mount in the last week of March and in the run-up to the April crisis over supply of medical oxygen. His role as Health Minister had diminished. On April 8, Modi again had an interaction with the CMs on the COVID situation. At this meeting too, the Health Secretary, according to the PMO statement, made a presentation. On April 23rd, the PM chaired a meeting with 11 surge states, and in that meeting, the country's COVID task force head and Niti Aayog member Dr. V.K. Paul made a presentation. Modi held multiple meetings in April with key central government officials, but Harsh Vardhan was missing. Similarly, he held meetings on April 16th, April 22nd and April 23rd on augmenting medical oxygen availability. At these meetings too, top officials and oxygen manufacturers participated. Harsh Vardhan on his part continued to defend the government by targeting political opponents who criticized the handling of the pandemic. He made these remarks on the eve of a meeting of the Prime Minister with Chief Ministers.